My name is Eric Kazarian. I am an otolaryngologist, head and neck surgeon, also known as an ear, nose, and throat doctor, and one of the relatively few surgeons in the world that specializes in the surgical treatment of snoring and obstructive sleep apnea. Snoring and sleep apnea are common, fascinating, and challenging problems that can affect your health, social relationships, and ability to get a good night's sleep to get the most out of life. Most people, including most surgeons, other types of physicians, and dentists, have an overly simplified view of surgery for snoring and sleep apnea, thinking that one treatment works for everyone or that surgery just does not work. Both of these are not true. In my videos and website, my goal is to explain my approach to making informed decisions with patients about what treatments might work best for them. I am committed to providing state-of-the-art patient care and advancing the field through research and the training of other surgeons in this country and around the world. In this video, I discuss snoring surgery. Surgery is a good option for many patients with snoring who do not or cannot get resolution with the conservative approaches that I outlined in a separate video on 12 steps to stop your snoring. I have other videos describing other aspects of surgical evaluation and treatment of snoring and sleep apnea. I hope you enjoy all the videos and my website. Most people have been kept awake at night by the sound of someone else's snoring. Snoring is just that, a sound caused by vibration of structures inside the throat, typically the soft palate and uvula at the back of the roof of your mouth. Snoring can be a sign of a more serious condition called obstructive sleep apnea. Obstructive sleep apnea often involves snoring, but also includes blockage of breathing that can cause health problems and can prevent you from getting deep, restful sleep, leaving you tired and unable to function well during the day. Typically, a test called a sleep study is ordered if someone has what we call disruptive snoring, or snoring that wakes up other people. A sleep study determines whether someone has obstructive sleep apnea. And in this video, I will focus on snoring without substantial obstructive sleep apnea. We all can laugh about snoring, but snoring can be a major problem, preventing anyone who hears it from getting sleep and driving them, or the person that snores, out of the bedroom. People come to see me all the time because of loud snoring, and the main goal is to reduce the snoring sound. The good news is that treatment can help eliminate snoring. It turns out that some studies provide limited evidence on health risks associated with snoring, showing that people with loud snoring, even without obstructive sleep apnea, may actually have an increased risk of death or narrowing of the carotid arteries that take blood to your brain, potentially increasing the risk of stroke. This is intriguing because we generally think about health risks only with sleep apnea, so more research needs to evaluate whether snoring has true health risks. Right now, I would say that health risks are not a major reason to treat snoring. When we are asleep, ideally we are breathing freely and have air going smoothly through our nose and throat and then into our lungs. Snoring occurs because of the natural relaxation of muscles in our body that occurs when we sleep, combined with a narrowing of the space for breathing. In general, treatment of snoring is based on opening the breathing passages to make breathing easier and smoother. Here is a drawing of a side view of our nose and throat, and you will see labeled the three major regions of the breathing passages that can contribute to snoring: the nasal region or nose, the palate region, which is up high in the throat, and the tongue region that is down lower in the throat. When I see patients with snoring, I focus on identifying the most important reason or reasons for the snoring so that we come up with a treatment plan that works. The most important thing is that we want to focus on the areas that are most likely to help rather than just blindly trying things. I have a separate video dedicated to treatment of the nasal region, and I will let you watch that video without repeating everything here. I will just say that there are many reasons that people can have trouble breathing through their nose, starting with the outside of the nose and including different parts of the nose and sinuses. There are medications, devices, and procedures to treat the nasal region that can be very simple and work well. Most surgical treatment of snoring has focused on the palate region because this is where the snoring sound typically comes from. Palate procedures work to reduce the snoring sound caused by vibration of the soft palate and uvula. The available procedures help because they either stiffen the soft palate or remove or cut tissue of the soft palate or uvula. These procedures are all usually performed in the office under local anesthesia. The first procedure that stiffens the soft palate is the pillar procedure. The pillar procedure involves placement of typically 3 to 5 implants into the muscle of the soft palate. The implants are made from a material that is sometimes called Dacron, and the nice thing is that the material has been used in the body for decades in medical procedures, mainly as part of surgeries involving major blood vessels. The pillar procedure stiffens the soft palate in 2 ways. First, the implants themselves have some stiffness. Second, there are actually small spaces in the implants where the patient's own muscle of the soft palate can grow into them and provide extra stiffness during the healing process. I was actually one of the first surgeons performing the pillar procedure in the Western United States, so I have a fair bit of experience with them. One of the nice things about the pillar procedure is that the pain level during recovery is relatively low, allowing people to get back to the rest of their lives soon. Palate radiofrequency is a controlled cauterization of the soft palate that converts some of this muscle to scar tissue. During the procedure, the tip of a special device is placed into the soft palate muscle in multiple areas, using controlled cauterization to create some damage that turns into scar during the healing process. This scarring shrinks the soft palate slightly, but more importantly, stiffens the soft palate because it converts the muscle to scar tissue that doesn't relax during sleep like muscle does. Palate radiofrequency typically also has relatively low pain during the recovery process, but it usually requires more than 1 treatment session. Uvulopalatoplasty is a general term that refers to surgery of the uvula and soft palate. It includes a wide variety of ways to remove or cut tissue, and I do this only when I see specific reasons to do so, basically reasons that a patient would not respond well to palate stiffening procedures only. Uvulopalatoplasty can be very helpful, although the downside is that it is typically associated with more pain than the palate stiffening procedures. As far as the reasons for performing uvulopalatoplasty, studies have shown that an exceptionally long uvula can limit results of palate stiffening procedures, so I may need to remove part of a long uvula. Someone may have extra tissue in a certain part of their soft palate, such as the area behind the tonsils called the posterior tonsillar pillars. These may be especially long or floppy, so the removal or cutting of tissue there may decrease the ability of this area to flutter around during sleep and create the snoring sound. There are a few technologies that have been used to perform uvulopalatoplasty, including cautery and various lasers. I use cautery and have for the past decade and a half because I find it provides the most control during the procedure and during the healing process. Carbon dioxide lasers were used in the past, but most people no longer do this because the temperature of this laser is so high, creating quite a bit of swelling and pain, as well as uncontrolled healing. Other types of lasers, such as one called night laze, are being marketed aggressively for snoring, but as of the time of this video, there was almost no research supporting this. When I say almost no research, I mean it. The studies of the night laze on snoring included a grand total of about 20 or 30 patients. In many patients, narrowing of the space for breathing in the tongue region can also play a role in snoring. Even though the tongue itself does not flutter and produce snoring sound, narrowing of the space for breathing in the tongue region can contribute to snoring by making the flow of air through the nose and throat less smooth and more likely to produce vibration of the soft palate or other structures, causing snoring. Because snoring treatment is generally not covered by medical insurance, the main tongue region procedure to treat snoring is tongue radiofrequency, as that is the tongue procedure that is the least invasive and can be performed in the office. There are a couple of different technologies that can be used for tongue radiofrequency. They all work in the same way that palate radiofrequency does, using controlled cauterization to create focused areas of scar tissue in the tongue itself. This shrinks the tongue slightly and also converts some of the tongue muscle to scar tissue. Because scar tissue does not relax during sleep like muscle does, tongue radiofrequency makes the tongue just a little smaller and, more importantly, less likely to fall back and narrow the space for breathing during sleep. Tongue radiofrequency is classically used to treat the back of the tongue, but I also treat underneath the tongue and the sides of the tongue based on the work of a Chinese surgeon who showed how to do this safely. Treating more of the tongue improves the benefits that you can achieve because you can get more of this tongue tightening effect. Tongue radiofrequency also has a relatively quick recovery, although it does require at least 2 treatment sessions. I hope you've enjoyed this video on snoring surgery. Snoring is often overlooked, but it can be very important to patients and a common reason people see me from around the world. The treatment of snoring is so interesting, yet challenging. Please do not hesitate to contact me with any questions or if you'd like to schedule an appointment.